Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Retinal degenerations. So, retinal degenerations. First, we will see the predisposing factors of retinal degenerations. So, predisposing factors of retinal degenerations are there can be lattice degenerations. Lattice degenerations are common in patients with high myopes, and it is also a circumferentially oriented spindle shaped areas of retinal thinning is seen. So, actually, if this is the retina, we see retinal thinning can be given either spindle shaped areas of retinal thinning can be seen with retinal tears and holes may be seen in lattice degeneration. Along with it, there can be other types of degeneration like snail track degeneration, acquired retinoschisis, white with pressure and white without pressure are the different types of degenerations. But main most common degeneration is lattice degeneration which is seen. So all these degenerations will result in retinal detachments. These will predispose the individuals to retinal detachment.
thank you and thank you for watching.